All right, so we are going to start at the top of the list with the number one thing that I always recommend. And anybody who's followed me for, well, even a short period of time, you're going to roll your eyes and you're going to say, yes, I know, Kim. But this is the number one thing that I really, truly believe would make such a huge difference for people implementing now, but also if we implemented this from a younger age, if this became part of our kind of accepted healthcare from a young age, I truly think pelvic floor physical therapy can change the world. I really do. And a lot of people think that I'm a pelvic floor physical therapist because I talk about it so much. I'm not a pelvic floor physical therapist. I'm a personal trainer and I feel very passionately about pelvic floor physical therapy. I refer to physical therapists or physiotherapists. It's terminology, same profession, but Canada, we call them physiotherapists. In the United States, physical therapy. In parts of Europe, generally physiotherapy. So women's health or pelvic health, physical therapists are amazing. And I collaborate with them all the time. I refer to them all the time. And I truly believe it's one of the most underused women's health resources that we have. And I feel that if we had the same PR that we do for our teeth, then it would transform our trajectory of pelvic health, our pelvic health story throughout our life. So from a young age, we are told to brush our teeth and floss and see a dentist once or twice a year. And we go for a checkup. And we go, even if we have no toothache or any problems to report, we just go for a checkup. And I really, truly believe that we would benefit from having that same practice with the pelvic floor, that we start a conversation in schools about pelvic health, about pelvic health physical therapists, and that around the time of becoming sexually active, it would benefit us from seeing these professionals once a year to help keep an eye on things, to help for that checkup, make sure everything's working as it should, and be able to screen for things before they become major problems. So my first tip for pelvic health longevity is to see a pelvic floor physical therapist once a year, even if you have no symptoms, but especially if you do. Next thing on the list is pelvic floor exercise. And most of us have probably heard the term Kegels or Kegels, and this is a type of pelvic floor exercise. It's evidence-based. We have lots of research to show that Kegels do work when they're done correctly, when they're done consistently. I think also we can up the ante a little when we coordinate it with movement, and there is some other research that came out fairly recently that showed people who couple pelvic floor exercise with resistance training see results quicker. So that's sort of embracing my bias, which is coordinating pelvic health into whole body movement. But even if we just do Kegels alone, they can be effective. I think they're a little bit limited, but they can be effective. However, we're never taught how to do Kegels. Nobody's ever screening us for them unless we have adopted the practice of seeing a pelvic floor physical therapist. So we need to learn somehow how to do them correctly. And if we have access to a pelvic floor physio, they, in my opinion, are the gold standard in terms of being assessed for, are we doing them correctly or not? And then once we are, then it's up to us as we have a responsibility of keeping up with, staying consistent with that practice. And what can sort of heighten our success with Kegels or pelvic floor exercise is our breath, our posture, some of our movement strategies, identifying maybe some compensations that we have. It's not just a do Kegels and it will solve your problem. There's lots of elements to consider. And physios really do take a whole body approach, as do many of the personal trainers like myself. So when I started in personal training many, many years ago, and even still, like none of the fitness certifications include the pelvic floor. But it's a group of muscles, and we're learning about all the other muscles in the body. Why are we not learning about what I argue is a super important group of muscles that needs to be trained with basically the same principles as the rest of our body? So there's lots now of fitness professionals who have become curious, and there are certification courses. I happen to have one that train non-pelvic floor physical therapists and other allied health professionals like non-internal physios, chiropractors, massage therapists, and fitness professionals, how they can assess for and screen for pelvic floor dysfunction within their scope, and how they can then pass on the knowledge to help these people move, keep moving, because so many people are told not to move, not to lift, not to twist, not to jump, not to do all of these things, which could arguably be creating an even bigger problem down the road. So learning to do pelvic floor exercise and then actually doing it is really, really important. And it's that consistency piece. I hear all the time from people who come and do my challenge and then they have success, they leave because their symptoms are gone, they think they're cured, and then they're back, 3 months, 1 year, 2 years later saying I wasn't consistent and now my problems are back. And I say ad nauseum, consistency, consistency, consistency. You have to be consistent. Once you've established the kind of retrained the system, established a stronger foundation, we need to keep it that way. That's part of the longevity. It's not just a once and done type thing. Just like we don't just brush our teeth once. We do it every day. It's part of a maintenance plan. So pelvic floor exercise, paying attention to posture, paying attention to our breath, coordinating it into whole body movement. And then we have other techniques that could be called a pelvic floor exercise as well, but are kind of more maybe postural. And one in particular is hypopressives. Again, if you've been following me for a while, you know that I'm a huge fan of hypopressives and have practiced them for over 10 years. And it was, I would argue, one of the most significant players in terms of me reversing my uterine prolapse. I absolutely love, love, love this practice, and it's one of that and walking. Hypopressives and walking are kind of my non-negotiables and are done pretty much every day. I'm not going to say that absolutely every day. There's, of course, days when it doesn't happen, but at least 5 days a week. It's part of my routine. I absolutely adore it. So hypopressives, if you're not familiar, I would highly recommend that you look into that. I have it as part of my Buff Muff community. There are also trainers around the world who can help you. But it's really, truly a remarkable technique and complements a Kegel practice or a Kegel type, I call it Buff Muff practice. So the two go hand in hand. They don't cancel each other out. I wouldn't necessarily choose one over the other. I think both of them play a really important role and can work super well together. Another part about pelvic floor exercise is resistance. We need to load this group of muscles. As I talked about, it's a group of muscles and we benefit from training them like we do other parts of our body. And if I want to become stronger, or if I want to train endurance, or if I want to train speed, I need to impart loads of certain variables that will train the muscles that way. And the pelvic floor is no different. We have slow twitch fibers, we have fast twitch muscle fibers, and just doing Kegels is limited, in my opinion. So yes, we have evidence to show that they work, but I don't think it can build as robust a pelvic floor as we deserve. And when we can add things on, like the breathing, like hypopressives, and resistance training. Now this is whole body resistance training, but also resistance training specific to the pelvic floor. So my approach is my Buff Muff community is where I coordinate pelvic floor contraction and relaxation into whole body movement. And we increase sets, we increase reps, we may increase the speed at which we do something. We add weight, meaning we might have some resistance bands or some dumbbells, so that we are constantly progressing and adding load for the muscles to adapt to and become stronger. We could also take weight and put it directly inside the vagina so that the pelvic floor has weight right there to manage. So Kegel weights or pelvic floor weights are a valuable tool. Now, this wouldn't be what I would direct people to go to as a first line of defense. Pelvic floor physical therapy is always at the top of the list. That's always where I would invest my money and my time first. They can then help you identify if something like Kegel weights would be appropriate for you, and maybe what the best brand would be, what the best practice would be. So it could be put it in, be in a semi-reclined position and do Kegels with your weight in. It could be doing them standing up. It could be do some squats and lunges with your Kegel weights in. It could be walk around the house for 10 minutes with your Kegels. So there's your Kegel weights in. So there's different practices with Kegel weights. It's not just about putting them in and leaving them there for the rest of the day. That's not going to serve you. Please don't do that. So I'm kind of painting a picture here as we're already doing some of these things, or maybe we have stopped doing some of these things like resistance training because we think that that's going to make our pelvic floor problems worse. It's going to make our prolapse worse. It's going to make me leak more. So maybe we've been told to stop lifting anything over X pounds, or don't do any heavy lifting. But what's heavy to one person is not heavy to another person. And it's not about the weight itself. It's about maybe our strategy, the way we manage intra-abdominal pressure in our bodies. So we can't blanket statement say, don't lift anything over X pounds or don't do this movement. It's really a lot more highly individual than that. But we need a whole body approach, and we need some variety. We need some diversity in our movement. I also really love yoga. I really love walking, Pilates, whatever floats your boat. Find what you enjoy and make sure that you have built and continue to maintain a robust pelvic floor that can manage all of the different loads that you are imparting on it throughout your day. So, number 1, pelvic floor physical therapy. Number 2, pelvic floor exercise, a diverse bucket of pelvic floor exercise. Next, I want to talk about diet and hydration. So I hear all the time from people who say, well, I probably don't drink enough. And a lot of people who are leaking urine or feel strong urges, maybe they feel like they go to the bathroom all the time, they are restricting their fluids. They restrict the amount of water they drink because they think, well, that will help me not leak and then I won't have any urges. But that will highly concentrate the urine, which can irritate the bladder, which can create stronger signals. And our whole body becomes dehydrated as a result as well. So increasing your water intake can often help with a lot of the pelvic floor symptoms that you have. Many people say half your body weight in ounces per day. I aim for between 2 and 3 liters spread out over the day. That's kind of, for me, what is my magic number. The other reason why hydration is important is because of our poop. We have to make sure that we're pooping well, and having adequate water in our system is going to help make sure we have a stool that's easy to pass and that's absorbing the right amount of water and working with all the fibers that we're eating. We also have to be eating fiber. So water is one of the first things that I talk about when I start working with somebody. So monitor your fluid intake with water. Also monitor your fluid intake to see if there's many bladder irritants that you might be consuming, whether it's eating or drinking them. So using a bladder diary, I can post a link below to the one that I recommend you use. That'll help you track what you take in and what comes out and what sort of symptoms that you have. And just, tracking all sorts of fluids. Caffeine and alcohol can definitely be bladder irritants and triggers for a lot of people. Doesn't mean it's for everybody. Dairy can for some. Artificial sweeteners, acidic foods. I think I've got the main ones on there. But just see which ones are potential problems for you and either reduce or eliminate them. Then when we come on to what we're eating, we want to make sure that we're eating a diverse diet from a gut health perspective, that we eat a lot of fibers. But constipation, which a lot of people deal with, can be a pelvic floor dysfunction. It can be from tight muscles. Could be from poor evacuation techniques. Could be from poor diet. There's lots of reasons why we have constipation. There's an episode I did with Rosalind Kent on constipation. Highly, highly recommend that you have a listen to that. Super valuable information. Because we all should be pooping well every single day without straining. Have a nice, big, glorious poo-gasm, as I call it, and then carry on with your day. And if we're not pooping well, we're not getting rid of toxins. That's bad for our hormones as well. There's all sorts of reasons why not pooping every day is not good. So drink the water that helps the poop, eat the fiber that helps the poop, and follow the strategies that Rosalind talks about if those first two things are not working. If you have increased your water and you have increased your fiber and it's not working, maybe there's something else, and she talks about other ways to address that. But make sure that you are getting that in check. So again, the water and the food are where I start at the beginning, because if somebody is chronically constipated, all of the work that we do for pelvic floor muscle training and posture and breathing is really not going to be as effective if they're continuing to strain every day or every other day, if they're not pooping every day, when they have a bowel movement. So that's really, really key. And being constipated can also contribute to a lot of the discomfort from prolapse, the urgency and kind of frequency that people feel as well. So that's really, really important to get in check. I am not a nutritionist. I recommend that you work with somebody who is a holistic nutritionist, somebody like Rosalind. She talks obviously specific to constipation, but there are many people out there who have similar backgrounds and could help you in a variety of ways. Next, I want to talk about tissue support. So we've talked about kind of the muscle piece and the tissues within the walls of our vagina, the tissues in our vulva. They deserve some care and attention as well. I recommend people moisturize their vagina with hyaluronic acid, and I don't recommend just going and getting any hyaluronic acid. Get one that's formulated specific to the pelvic floor. I'll put the link to my favorite one in the show notes below. And this is something that you don't need a prescription for. It's something that you don't wait until you have symptoms. You just start doing it proactively. Just as we take care of the skin on our face, we should be taking care of the skin on our vulva and our vaginas. And it really loves hyaluronic acid and loves to hold on to moisture. So moisturize your vagina. Along those lines, another support could be vaginal DHEA. And DHEA helps with the conversion of estrogen and testosterone and is a non-hormonal option, as is hyaluronic acid, to deal with vaginal dryness symptoms, to also maintain the health of the tissue. One of my favorites is Julva. Again, I'll have a link in the show notes below. This is manufactured by Dr. Anna Kabeka, who has also been a guest on the show. Highly recommend you listen to that episode. She's a wealth of knowledge and has just an incredible lineup of products to support people through the menopause transition. And talks a lot about sexual health, vaginal health, pelvic health. She's really a wealth of information. So definitely recommend checking out Julva. And you can use vaginal moisturizer and Julva. And you can also use vaginal estrogen. So I use all three. Vaginal estrogen, more and more research is supporting starting around the age of 45 and staying on for the rest of our lives. Dr. Rachel Rubin, who I hope to have on the show at some point, is a really great resource. So I'll put a link to her contact information below. She's a urologist, very evidence-based, has brought a lot of attention to vaginal estrogen, and highly recommend that you give her a follow and that you consider adding it to your repertoire of tissue support. So vaginal estrogen is used locally, meaning in the vagina and right at the opening. It could be in the form of a ring that's inserted. It could be a tablet, could be a cream, and it helps maintain the vaginal pH. It helps eliminate the dryness, the burning, the irritation. It maintains the integrity of the tissue so that it has suppleness. It can help with painful sex. It can help prevent clitoral atrophy, vaginal atrophy, which is the thinning of the walls or the retracting of the skin around the clitoris. So it really is, I think, an essential component to our tissue support as well. Then I'm going to talk a little bit about sexual activity, and another product would be lubricant. So vaginal moisturizer, DHEA, or estrogen do not replace the need for lubricant. Lubricant is for sexual activity with or without a partner. And depending on if you're using a toy, you would want something that's water-based, depending again on what you're using, if anything. So lubricant is helping eliminate friction, and it's not replacing vaginal moisturizer. It's not replacing estrogen, nor is estrogen replacing lubricant. So estrogen, DHEA, moisturizer, and lubricant, that's kind of four things that can all serve to support the tissues and all play their own independent roles. Moving on to supplements. So again, there's not really a ton of research that says you should be supplementing with this X supplement to support your pelvic health. But indirectly, when you look at research about vitamin D is hugely important for so many things. And there have been some published studies looking at the vitamin D status of people with pelvic floor dysfunction, and it was lower than those who had more favorable pelvic floor outcomes. So vitamin D is something that I recommend we supplement for many reasons, but supporting pelvic health as well. Magnesium. A lot of people use magnesium to help with their poop, and magnesium citrate is typically the one that helps the most with pooping. Some say magnesium oxide can also help with that. Magnesium glycinate or bisglycinate is more mood and sleep support, and you could potentially take a combination of all of those. Magnesium threonate is more brain support. There's one magnesium that's very comprehensive. It has a bunch of different types of magnesium in it that I really love. I'll post a link to that below as well from Bioptimizers. So magnesium is something that can support, again, many aspects of our health, and I do believe it plays a role in our pelvic health as well. Fish oil is something else that I think benefits, again, many parts of our body, reducing inflammation. And there was some evidence and studies done with the people with pelvic floor dysfunction having more oxidative stress. And fish oil is something that can help reduce oxidative stress. So that's another thing that I recommend. And it's important to find out, you want to find good quality, I guess. So do your research on the company, look at the ratios of EPA and DHEA. DHA, it's important to understand the philosophies. Now, I am not an expert on any of that stuff. The Dr. Andy Huberman has a great podcast where he talks a lot about supplements, and is a great, I guess, resource that I would direct you to. Collagen. I wrote an entire blog post about collagen in the pelvic floor, and again, there's nothing to say that if you supplement with collagen, it's magically going to reverse your prolapse and improve your incontinence. We don't have that, but we can hypothesize, or we can speculate based on research that what collagen is doing to the skin, hair, nails, because we have a lot of the same types of collagen in our pelvic floor as well. So I post the research about collagen supplementation. I also post the research that shows the people who had, it was one about prolapse, and they had less of certain types of collagen. So collagen is something, again, not just for the pelvic floor, but our entire body, that I think is hugely beneficial. A great book is called The Collagen Cure, and collagen is something that I do supplement with as well. So I'll post a link to the blog where you can look at all the research, and I post 3 different types of collagen that I have used and have noticed a difference with and support. 3 other ones that I have just started with, and again, zero evidence as it links to the pelvic floor. But from an overall longevity perspective, Dr. David Sinclair is somebody who I'm following very closely, and he talks about NMN, resveratrol, and he doesn't talk about spermidine, but a lot of other people that I follow in the longevity space talk about spermidine. And those are 3 that I have begun supplementing with that I think are worth investigating to see if they may play a role in your health span, potentially. So I'm just kind of planting the seed on those. I'm curious about more research that comes out and how it may pertain to pelvic health as well. Now I'm going to move on to devices. So these are home use devices. And the first one is red light. So the first time people saw me using red light was during my surgery recovery. I have a big panel from Orion, and I use that externally to help heal in my post-op journey. But I also have an internal red light therapy device that I've been using for years called the V-Sculpt, and this is by Joylex. The company also makes one in the United States called the V-Fit. It's the same as the V-Sculpt. It's just the naming requirements of Health Canada versus the FDA. Same product, different name. V-Sculpt in Canada, V-Fit in the United States. And this, hands down, is my most favorite device. I'm a huge believer and supporter and lover of red light for many, many things. And this is a device that sort of looks like a big white dildo. And when you insert it into the vagina, there's red light, there's infrared heat, and there's also sonic vibration. And you can turn the vibration on or off. You don't have to use it, but the three together can help stimulate collagen and elastin, and it helps with moisture levels. It can help with muscle function. I do my Kegels with it inserted against that vibration. And Colette Cordian, who's the developer, inventor of this product, was also a guest on the podcast. So I highly recommend that you go and listen to that episode as well. Love, love, love that device. The other thing that I have recently started using that I hadn't really given a lot of maybe time to before is e-stim. So electrical stimulation is something that it can be used in lots of different ways. There's different types of electrical stimulation. And as it pertains to the pelvic floor, it's usually a probe of some sort that's inserted into the vagina. And then there are currents that will stimulate the pelvic floor to contract and relax at various different cycles. So there's different programs, different intensities, different lengths of time in these programs. One that I've tried recently is the Yarlap. Another one that I also really like is called the Kegel 8. I think it's the Kegel 8 Ultra that I have. And the reason I've started paying a bit more attention to this is I have suspected partial avulsion, levator avulsion. And this is something that I've seen pelvic floor physio for years, but I changed pelvic floor physios before my surgery. And she highlighted, she said, I think you have a partial avulsion on your left side. So I have not had this confirmed with imaging. I'm going to have it confirmed with imaging in September of 2023. But if that's true, it explains a lot of things for me. And I'll go into that in a whole other episode. But where I think that e-stim can come and play a role is for people who may have injuries like a levator avulsion. Levator avulsion is where part or all of the muscle can pull away from the bone. And it's from a birth injury, and typically traumatic birth injuries. And you can have unilateral, just one side, you could have both sides, and it could be partial or complete. And when that disruption has happened, the capacity of the muscles to do their jobs is hindered if it's happening at all. And so I think that there could be, again, I don't have any research or evidence to support this, but I think there could be a role of e-stim, ideally way earlier. I found out that was like 15 or so, 16 years after my second birth, and would have been like about 17 or so years after my first birth that I found out about this. So I think intervening, I don't know if I'm going to blanket statement say everybody who gives birth within like the first couple months starts using it, but maybe it's warranted. But it can come in and kind of help restore some of the disruption to muscle messaging and nerves that has happened as a result of childbirth. So I've been using that a little bit more recently, and just kind of see what, if anything, any changes that I notice. So I'll keep you posted on that. But I do feel like there is a role for e-stim. I wouldn't just give it to somebody and say, here, have this device do Kegels for you. I think that if we have the capacity to activate and relax our muscles on our own, that we benefit from doing that. This could supplement our own kind of buff muff practice. Along the category of e-stim, there's also something called the Emsella chair, which I'm going to talk about in a minute when I get to kind of the more of the vaginal rejuvenation, but I'm just planting that seed that I will talk about it. Then the last thing that I've also been trialing out just recently is the Silken Titra. So this is, again, an at-home use device that uses radio frequency, and it can help, the heat penetrates the tissues to help the production of collagen is essentially what's happening. So jury's still out on that one. So far, easy to use, comfortable to use. I'll keep you reported on any changes or sensations or symptoms that I feel with the use of that. So the V-Sculpt is something I use regularly. Lately I have been using e-stim more regularly. My buff muff exercises, my hypopressives, the supplements, lubricant during sexual activity. These are all things that I'm doing. 2 to 3 liters of water a day, fiber-rich, diverse diet. And now I want to talk about the vaginal rejuvenation. I'm going to end here. And vaginal rejuvenation is a whole world in and of itself, and it's usually at the med spas that are around, offering Botox and facial therapies, but now they are also bringing in vaginal rejuvenation because it's a lot of the same technology, kind of like Colette brought in red light that she was using in her med spa for faces and for skincare. She brought that same technology into the tissues within the vagina. And so there are lasers, there's radio frequency devices, there's light, heat, there's all sorts of different technologies, and it's important that you know that one vaginal rejuvenation therapy is not the same as another. So make sure that you know the technology of the one used where you are investigating it. Ask for the research, ask for the results. How many of these have the doctors performed? So there's a lot of education that I think still needs to happen. There are some people who have great results, or some people who have zero results, and these therapies are expensive. So you really want to make sure that you are choosing what's right for you based on the symptoms that you have, and that there is some proven evidence and also proven testimonials from people who have experienced the results that you're hoping for. The Emsella chair I'm coming to now they're popping up everywhere, and this is basically a chair that you sit on fully clothed, and it will do, upwards of 11,000 Kegels, high powered, like super max contraction Kegels for you. And you just need to sit there, which sounds, again, lovely. Great. If I don't have to do the Kegels on my own, then I can just sit in this chair. It's easy peasy. It is expensive. It is not a lifelong fix. So it would need an element of maintenance. And again, I don't view it as, if we have the capacity to do the work, we should be doing the work. We shouldn't be outsourcing everything. That being said, there are certain populations, potentially the levator avulsion group, potentially people with nerve damage, potentially people with mobility issues or spinal cord damage who could benefit from this amazing technology. And I'm going to be speaking with Dr. Sinead Dufour, who has done a lot of research with this and will highlight more of the benefits of this technology. So I don't want to poo-poo it, but I also am not going to say everybody should be running out and sitting on one of these chairs. I think it will have a place, but it's not the first place. And then the final thing I think is PRP, platelet-rich plasma. And again, if we think of the facial skincare world, if you've heard of the vampire facial, that is essentially a PRP facial. PRP is platelet-rich plasma. Your blood is drawn, it's put into a centrifuge. It takes out the plasma, the platelet-rich plasma, and then that plasma is re-injected into your body, and it's being used all over the body. And in the vaginal rejuvenation world right now, the on-label use of PRP is for the O shot, and this is for increasing sexual satisfaction. It's inserted, the injection happens near the clitoris and also in the front wall of the vagina. And I think there is tremendous opportunity with PRP for birth injuries again, potentially in the immediate days, weeks following a birth injury, but even for anybody. I think we could argue that there's damage to anybody giving birth vaginally or even via cesarean. And I have recently heard of a doctor and a pelvic floor physical therapist in the United States who are collaborating to provide PRP treatments to the pelvic floor. And these are 2 more people that I hope to have on the show. And I'm also hoping to see them myself in September. So I'll keep you posted on that. But I do believe PRP and stem cell therapy is such a huge opportunity as it pertains to pelvic health and our pelvic health longevity. So I'm going to wrap it up here. That's kind of my top list for what I do and what I believe in and preach and support for our pelvic health longevity. Links will be posted below, and I will see you next time. Thanks for listening.